In 2019, I travelled to New York for gender confirmation surgery. It was a groundbreaking surgery at the time with Dr. Ting. I had peritoneal vaginoplasty, which is a technique not yet available in Australia. It's been about a decade-long process to get where I am today. There's been financial, physical and psychological process that I have to go through to really get to this point. The costs can be quite prohibitive for people transitioning. I'm in about 100,000 so far. Before my surgery, I was thinking about my healthcare needs and felt that a gynaecologist would be really important in that process.
Treating transgender patients is a new area in gynecology. The number of transgender patients are increasing. We need to have the skills to provide the best care for these people.
Did I think it'd be difficult finding a gynaecologist? No, I thought it'd just be like finding any other specialist in my healthcare, whether it be a psychologist, an endocrinologist, a surgeon, or any other doctor that's helped me through this process. The reality was that my GP was finding it difficult to find me a gynaecologist. I couldn't get a referral. I'm surprised at how difficult it actually turned out to be. I ended up ringing multiple gynecologists who all turned me down. Not really sure why that was my experience. It was a bit hurtful, but I think it just comes down to a lack of understanding.
All people, including transgender patients, are entitled to care that's non-judgmental. Discrimination often happens because of lack of knowledge and ignorance.
I feel like there's a stigma or a misconception that we don't actually have any gynecological needs, where the truth is we actually do. So I'm pleased to say that post-surgery I've been able to find a gynecologist, and that's been really critical in my aftercare, in treating my surgical site, make sure I'm healing correctly, the scar tissue, the basic function of my vaginal health.
The optimal time to treat this patient is 6 weeks post-operation to ensure that there is no urinary dysfunction, and also we can then prepare them for sexual function. Ongoing care for transgender patients might include taking care of the surgical scar, vaginal diameter, urinary symptoms, vaginal discharge, as well as their HRT.
I've seen so much progress in my community, but I think the real gains will be made through the legislation and the healthcare providers.
This progression in gynecology will empower the transgender women to receive the care they deserve like any other woman.
If progress is made, then people like me won't feel marginalised and will have access to basic healthcare.